Research studies have shown a direct correlation between garlic consumption and better cardiovascular health by reducing blood pressure, cholesterol, and arterial stiffness. To help break down the science of how aged garlic extract helps support better heart health is Dr. Matthew Budoff, a preventive cardiologist at UCLA Medical Center. Dr. Budoff, thank you so much for joining us today.
It's a pleasure to be here.
Now, you've led many research studies about the healing powers of garlic. So talk to us about the role of garlic in maintaining our immune system and heart health.
Yeah, so, I've been doing garlic research using this kyolic or aged garlic extract for about 15 years now. And we have now 5 randomized trials that show that it preserves heart function, that it makes the arteries better. We actually saw less plaque at follow-up in those patients who were taking the aged garlic extract. And we also know that it has an immune response where it protects against bacteria and viruses, which has been well studied for many, many years now.
So is this preventative or is this for treatment?
I think of it more as preventative. It certainly can be used for people with some earlier forms of disease, but if you have very advanced heart disease or very advanced infections, the aged garlic extract is probably not enough to really, you're going to need help. But it is a nice complement to traditional therapies, and it is very preventive.
Now, being that this is a vegetable, right? So let's talk about the supplement when it comes to absorption, and in what form should garlic be taken to be most effective?
Yeah, so, obviously garlic can be put into food, can be eaten raw, can be, there's many ways of preparing garlic. And the problem is that some of it may deactivate the garlic or the active components. So what we've been studying is an odorless version of garlic called aged garlic extract. Imagine how grapes turn into wine and the aging process. The same thing happens with garlic. It becomes less toxic and better to tolerate, and the odor goes away. So it's much nicer for your spouse or significant other if you're taking it because you don't smell like a garlic clove all the time.
Now, talk more about the active ingredient in the garlic. What is it inside that garlic that has such powerful antioxidant effects?
Yeah, so we think that a lot of it is due to the sulfur compounds. The S-allylcysteine is the formal name, or SAC. But we think that it's these sulfur compounds that actually have antioxidant properties, so they preserve the cells, and they have anti-inflammatory processes, so they stop the inflammation of the cells, and they really have a nice impact on both cardiovascular disease and infection.
Who should take it and how much should they take?
So I advocate for patients to take 1,200 milligrams a day of this aged garlic extract. Some people obviously eat a lot of garlic and probably don't need to supplement their garlic, but if you're not a huge garlic fan, it's much easier to take an odorless compound, and it's a lot easier on your stomach. I'd say anybody who's at risk of heart disease, patients with high blood pressure, patients with high cholesterol, patients with a family history of heart disease would all benefit from the preventive aspects of garlic therapy.
Talk more about the role of garlic in fighting off infections given this COVID-19 pandemic.
Yeah, so garlic's been around for millennia. Literally in the ancient Greek Olympics, garlic used to be used as a performance enhancer. And there are literally hundreds of studies showing that garlic helps prevent bacterial and viral infections. Now, having said that, I don't have direct data on COVID, but garlic is very effective against other viruses, and we would anticipate that it's also effective against COVID, but we haven't done a formal trial of that.
Dr. Budoff, we're going to leave it there. Thank you for joining us today.
It's a pleasure. Thank you so much.
That was Dr. Matthew Budoff, preventive cardiologist from UCLA Medical Center.